Good morning, everyone. Morning. Yes, my name is Aaron Sanga, and I'm Program Officer from Hub Tanzania. I'm really happy to see you all in this impactful session, and I hope we are going to discuss insightful that will be a stepping stone to sustainable future. And first of all, I would like to thank you, Extreme Hangout, for having us to host this session here at their space. Without wasting of time, are you hearing me? Yeah. Without wasting of time, I would like to introduce panelists. They are excited, so expect more from them. We have Julie Greenwald. A hand of applause, please. Then we have Joy Harlem.
Hi.
Then we have Smut Dukal. Thank you. So we are going to have some question. I will start with Smut Dukal. You're welcome. So how can urban planners and the architect integrate the concept of climate wellness into the planning and design of housing, water, and sanitation systems in this vulnerable community to enhance mental health and physical well-being? You're welcome.
So I'll talk about three things. One is that I think urban planning generally, and planning both as a profession and many allied built environment professions, have failed miserably in planning cities the way they should be, because the fictitious plans are very far away from reality. There are these nice plans that are made for 20 years that do not follow often the realities that are there and the realities that are to come. And that's why you see that a major portion of the big 2030 megalopolis that the world has today, especially in the global south, have issues of deficits of serious water, sanitation, etc., which has a direct implication on health and well-being. That's number one. Number two is that I think we do not have the resources to look at urban development and climate change issues separately. Neither do cities have the kind of resources to make investments separately, and that's why it's important to look at the two together. It's rather to look at urban development with a lens of climate change on it, and that the sooner we start doing it, the better it is for us, and it'll help both for communities to work in collaboration with the city officials and for cities to work together with communities. The third thing is that there is very little investment that is made at the local level, and climate finances do not work in a way that it makes direct implication to work for the realities of communities. And therefore it's really important for both urban planning and to look at the scientific evidence that comes from understanding climate change, of what implications it makes to people living in informal settlements or informality, and what does it mean for them, for their health and well-being generally, which is not the indicator that is usually taken up. The indicators are, we are too busy making matrices and scientific analysis, which really does not mean anything to poor people. For them, it's more about trying to know, can they sleep better when it rains too much? Because often they live in shacks which is made of metal. It's too noisy. It gets heated up too much during heat. So what does it mean for them and for their health? And how those realities can transform into working together with scientific evidence and knowledge that is produced elsewhere, to come together and make investments in a way that it works for realities of people.
Thank you. Oh, that's nice. And okay, I will come back to you later. Joy Harlem, I have one question for you. how does the climate change specifically affect the physical and mental health of children, especially in vulnerable communities?
Okay, thank you. So, numerous studies worldwide have shown that climate anxiety is very, am I speaking too loudly? Is very common amongst young people and adolescents. Like up to 67% of youth say that they're afraid and sad thinking of when they're faced with climate realities today. 75% of respondents are actually frightened of the future. So that's what this is what the current realities are. So you can imagine as things get worse, this is just going to add to the level of anxiety, the level of mental stress that young people are faced with. Additionally, the after effects of a worsening climate means that things like extreme weather events, extreme heat stresses, so on and so forth, lead to extreme vulnerability. They heighten chronic existing factors of vulnerability. They lead to social tensions. They lead to increasing poverty and deprivation and marginalization. I can tell you the Child Fund Alliance has put out a call to action for children for these three COPs. And I would like to tell a very brief story that just think of a child who was born in 2015, the year the Paris Agreement was signed. By 2025, next year, that child is 10 years old. In the meantime, through the support of local civil society, through support of climate actors and so on, climate smart farming, agriculture, community-led initiatives have been put in place. But these are only temporary measures, right? Due to insufficient investment, their impact remains limited. Extreme weather events, as they intensify, the current pattern is they are going to keep intensifying. So you get to 2030, by which time there are recurrent crises and cyclones and droughts and earthquakes and what have you. So this child, who by 2013 is now 15 years old, will have to most likely migrate to a city with her family. There, this child, who previously had good access to education, was doing well at school, will probably not be able to access schooling, basic healthcare, and so many other basic essential services. As a result of that, that child may then have to resort to in the informal economy, even things like garbage collection, whatever, low-skilled and low-paid jobs. This child could be exposed to trafficking, to abuse, to child marriage, and a host of other issues. So by 2035, if we continue on current patterns, the world and cities is flooded with migrants, rural migrants. Many cities are close to becoming unlivable, unbearable. So this child would then be very much entitled to say, why could action not have been taken earlier? Yeah, thank you.
Thank you. So what you
it's
say,
all in here.
Sure. So what you say is children are already affected by climate change. Yes. So that's it. And for those who are joining us, we are speaking on climate awareness, redefining health and the climate resilience through physical and mental well-being. So we are trying to see how climate change affects the people both physically and mentally. Okay, next is Julie. I have one question for you. How does climate change specifically affect the physical and given the interconnected nature of climate and health challenge, how can cities foster effective collaboration between health and the climate sector to reduce urban well-being?
Great.
Yeah, you're welcome.
Thanks for the question, and thanks for having me. I think, first of all, I just want to say, I think it's wonderful that you're having this session that focuses on linkages with health, and that you highlighted both the physical and the mental. I think sometimes the mental health gets overlooked, and unfortunately we know that in a lot of cities, a lot of people, well, not just in cities, but a lot of people don't have access to the mental health care that they need. If we even just remove climate change from the equation, and then as you've talked about, the stress that young people especially are feeling, like it just compounds the need for mental health care. And I think this is something that we're really just starting to see all over the world. But you ask about cities, but I'll start at the national level, because I think it's important also to think about the role national governments have to play in this. And there's a lot of planning processes that are going on right now at the national level in terms of NDCs, in terms of NAPs, and other climate strategies. And I think this is really the starting point for making some of those linkages. So for example, in Ghana with the National Adaptation Plan, they've chosen health as one of their key sectors that they want to focus on in terms of identifying adaptation solutions. And so it really can start even at that level, because that helps to guide where the funding priorities go. But I think that's a positive trend. But I will say this is a place where there's not a lot of expertise, or there's not really sufficient expertise in understanding what those linkages are. And so there's really a need for more people that can bridge this knowledge about physical and mental health and well-being with the climate risks discussion and also climate solutions. So, I think, and then also if you, want to get really tricky, you add in the urban planning layer, right? And so the amount of people who really can take urban planning, physical and mental health, and climate, and really bring that together and help to come up with creative solutions is one of these kind of bridging connector roles that there's just not enough people. So if you're looking for a career, I would recommend this is something, that could be pursued. But, I think it is about making sure we have sufficient capacities. And because a lot of people who work on climate change have blind spots, and I will say health is one of those blind spots. Children, I think, is probably another blind spot. Cities used to be a blind spot, but it is increasingly less so. I think more and more people recognize the role of cities and how climate risk is differentiated in urban areas. Then I think when you get to the city level, one of the really important things is around health infrastructure, accessible health infrastructure, and climate resilient health infrastructure. So I was in Sierra Leone about a month ago, and again, this is one of my blind spots, but we were visiting one of the slums. It was a group of slum dweller federations from different countries, and a young man from Zambia actually said, where are your health facilities? And, they said, oh, it's about 2 kilometers away is our closest health facility. And he was like, that's not right. That's too far away. And it wasn't even something I had thought about. But, he was like, it was the first thing he noticed when we walked into the slum is I can't see any health facilities, and I don't know where they are. And I think, this is critically important that they are accessible to the people in need, and then also that they're resilient, right? So if there's a flood that hits and your health facilities are not climate resilient, then that reduces the adaptive capacity of that community, right? You have major issues if your only health facilities are not accessible and they get damaged in storms, or they don't have sufficient air conditioning, so they aren't able to help when people have heat stroke. So, I think from the national level to the city level, and then of course within communities, and I think there's also a lot of studies that have been shown that community connectiveness is really important in terms of helping people with different types of vulnerabilities. So whether it's elderly people, whether it's children, whether it's outdoor or informal workers, having that community connectiveness where neighbors can check in on each other is incredibly important for both physical and mental health and well-being. And it's not just in these major events, which we see more, it's also these sort of like lower level stresses that are causing people to have, whether it's mental health issues or whether it's also physical health, but the ability for people to check in with their neighbors. And I think, I did a study, or I supported a study years ago that was in India, and it was looking at community resilience indicators in slums. And one of the things that was found is that while some of the newer slums maybe have better physical infrastructure. They have less social connectivity. And some of these older slums have, more of a sort of social connective tissue. And as a result, they actually have higher levels of resilience. Even if their physical resilience is lower, having that community connectiveness can overcome some of these areas where there might be a lack of support coming from the city or the national level. Ideally, it all comes together, right? The national level is providing that underpinning for the city to take action on infrastructure, and then for the community to bring together the connectiveness. But we know that that's not always happening everywhere, so we have these gaps.
Thank you. So what you have said is still a healthy aspect is overlooked by most of government and most of agents. And for example, if flood hits a certain place, people, they can get food, they can get shelter, but they forget that these people are affected mentally and they should get help. So that's a good insight. Thank you. Thank you. Okay, so back to Samlut. As urban planner, you are doing an amazing job. And I have one, how do you think on the, what the specific strategies have you seen successful foster resilience and well-being in urban poor community, particularly in the context of climate-induced challenge like displacement and housing insecurity?
Okay.
How do you see?
So first of all, I think in the work in urban, there's nothing called as foolproof successes. There's no silver bullet there. It's long-term investments, and there are only breakthroughs. And there is more and more investment that goes into processes that then learn from one another as exchanges and knowledge that we have within our network. I could share with you 2 examples. So one is more about this reality of understanding that more and more people come into cities to find work, something that we all know, and it has taken a long time for both in urban development and climate sciences, like Julie was saying, is to acknowledge and accept this reality that cities is what is going to be the future. And in most of the cities, there are these huge townships. We call them townships. These are not like small pockets of settlements here and there. These are huge townships which are in the seas because, one, for long term they have been neglected by cities, and now they are so big that it's easier to believe that they don't exist and to move on to other parts of the city, which is easier to plan and which is more formal. And for a very long time, while people have been facing issues of evictions and fire hazards, and there are other serious challenges of health and well-being which naturally come because of the vulnerabilities within which people live in informality. There was always this thing of trying to work with people living in these huge townships to come up with standards that work for communities. And it's very important to understand that often that in the global south, none of the formal censuses that are taken by national governments often incorporate data that involves people living in informality. And because you don't have data, you don't know that their needs are similar to that of everybody else, but you cannot apply the same protocols and standards that you apply for the rest of the city to work for them. And this is a case in Kenya. In Nairobi, there's a settlement called Mukuru, which houses a population of 300,000. It's huge, it's abutting the international airport. And for 20 years, going back and forth with the governments and with the private sector, the communities, together with a group of professionals who supported and invested in this process, came up with an alternative plan which looked at urban planning and also to look at alternative standards that work for people living in informal settlements. So to give you an example, for the densities like there are, it would be too virtuous to talk about an ideal situation to have one hospital in a, catering to 100,000 population. But let's start small to have clinics that could work, that at least identifies and helps people screen the basic health profile. to have, instead of having big schools, to have smaller schools where there is a possibility to have them. And rather than believing that there could be big parks, which actually could consume the entire area where people are living, to have smaller recreational facilities. And like that, we have broken down every single amenity to come down to the level of to work with the densities that are there, and to say, instead of having big roads, which is impossible without it causes relocation, displacement for communities, to have roads that are good enough for people to walk and for people to have safe walkways. So that was one, and it was a very big breakthrough, because first time in the history there is a plan that is coming up from the realizations of realities of local communities, and it works to standards that is workable in the short term for people, and in the long term the city then can subsume this to become a part of the larger city. So you have public transport that now flows through these townships, instead of, earlier it used to just stand outside and not come inside. So that's one. The other one is a global campaign that we call Roof Over Our Heads, and it is to look at working with communities and individuals, especially centered around women and their needs, and the kind of challenges that they face with too much heat, too much rain, and too much wind, and what are the small interventions that could be made while working with them, acknowledging that there is traditional wisdom and information that people have gathered over generations, and they have their ways in which they can work, and to bring in professionals and people from allied networks who could come and make investments in intellectual knowledge and scientific evidence to come up in co-creating solutions that could work for communities that are affordable, accessible, adaptable, and accessible. Because often what happens is that there are these nice, cute little projects that are there somewhere, which are fantastic, but they cannot be scaled, they cannot be, transferred, and it often doesn't work for communities. And this is a book that we're going to launch on the 21st, and anybody who wants an e-copy of it, feel free to come and speak to me, and I'll do it. I'll share a copy with you, and it actually, is a representation of actually how people build and how they see the challenges of climate change and what it means to them at that micro granular level.
No, thank you so much. That's nice. And we have another panelist here. She made it. Welcome, Elizabeth Wathuti. You are really welcome, and you are doing an amazing job. So she's going to give us a perspective on how youth engagement can improve climate well-being, or can improve physical and mental well-being for the children and youth who have been affected by climate impacts. So what's your perspective on that question?
Thank you so much. Elizabeth Wathuti, founder of the Green Generation Initiative, and I also serve as a commissioner in the Global Commission on the Economics of Water, spearheading the Youth Water Agenda as well. And came in late. I was just transitioning from another meeting in the Blue Zone, but I'm glad that I could be able to share my perspectives within this session with my fellow panelists. I think one of the perspectives around well-being and the challenges we're experiencing in the world, beginning with the climate crisis, we have the biodiversity crisis, water, all these are things that I like to call interconnected. We most often treat them as though they were separate, but they're very much interconnected. The drivers are similar, and I do believe the solutions as well. So one of the perspectives is there's so much happening around the world that can be frustrating, that can be overwhelming, and I believe as young people, we're able to come in is how we can be able to turn these frustrations into a hunger to want to do something about these perspectives and these challenges that we face. And that is one of the ways in which I personally got involved in the climate and environment space. And it was purely by experiencing deforestation in a nearby forest that I loved so much that I started planting trees at a really young age. And I think for me, seeing that forest deforested, I couldn't understand why anybody would interfere with such a beautiful ecosystem. But then I did not stop at the frustration. I did not stop at just, feeling bad about it. I told myself that there is something I can do within my own capacity as a young person. I may not have the capacity to do everything, but there is something I can do from my community, from where I can begin. And I believe also that's how we have been able to do a lot of the initiatives we've done today, by just asking ourselves, what's my solution within the challenges that we experience? And I believe this is what we say, that people find hope in action. People don't find hope in promises, in pledges, in commitments. People find hope when they see things are actually moving, even within the COP process. And I believe this is where young people have greatly championed and made a push so that policymakers can go beyond just talking about it, but actually implementing solutions. We are the largest majority, young people. And in sub-Saharan Africa, we have more than 70% below the age of 30. But the beauty about it is not just about us being big in numbers, but it's about our innovations, our ideas, and the solutions that we are already spearheading to support our own communities to build their own resilience. And I believe these lives we are changing within our communities is what should fuel us to continue doing more and more. And of course, one thing that I've learned is the fact that being in this space can definitely be overwhelming, especially when you're not within a part of a community. And that is what we've been able to, come together as young people and ask ourselves, how do we create communities of people across continents, across borders, across nations, where we can learn from one another, where we can exchange ideas, but also where we can come together in solidarity and say, look, this is happening in my country and I want your support, even if you're from another country. I think building those connections, building those movements, making the movement much, much more stronger. And lastly, making sure that even within the COP spaces, there is so much presence of young people within the COP spaces, for instance, compared to the previous times when these COPs were starting. And asking ourselves, how do we keep the momentum after this COP? There's going to be a lot of conversations happening here, but I believe it's back in our countries that we can drive the real change and the real actions that leaders are talking about here. And that is how we can be able to continue, shaping ourselves, finding ways that fuel back our energy and keeping that momentum very closely. And then the last thing is, how do we continue driving and pushing for beyond representation at the COP? Yes, we are present, but how are we making sure that as young people, our perspectives, our ideas, our initiatives actually trickle down to the decisions that are being made here? I think that is what, again, will bring hope. That is what will make us, again, continue pushing, because we can see that we're not just speaking, we're not just present, but we're present in the decision. When people are speaking about climate finance, we have to be present. When there's climate finance allocation, how much of that is trickling down to youth-led initiatives that are happening on the ground? I think these are critical conversations also that need to come up, because for me, I believe in finding hope in action and finding hope in where the real, tangible work is happening. And I'm really proud that young people are driving that, are the driving force for that, because the challenges we face today, even if you look at the climate finance conversations, people talk about climate finance, but I don't know how many are talking about the fact that the existing climate mechanisms have been full of mistrust, but have also been full of challenges like the debt burden in our countries. And this finance, when it comes in the form of loans, most of which are non-conventional, and it's our generation that's going to have to live longer with that debt burden. So we have to look at those perspectives in a big way, and how can we transform that right now so that we are ready for the challenges of the future, and so that we can actually, get people to find that hope, not just find hope by what we're being told, but find hope in demonstrating real, tangible action that is happening on the ground.
Thank you, Elizabeth. Thank you so much. Back to, because time is running fast and there is a lot of discussion. So back to Johi. What do you think on specific climate strategies focused on early childhood development, and that can be implemented to build resilience in children against the health impacts of climate change. So what's the strategies?
Okay, well, first of all, I'll pick up on something that Elizabeth was saying, that it is absolutely essential to engage and support youth to become involved in climate actions in their communities. This is the best way of engendering hope and of creating or helping to prevent a sense of powerlessness, because otherwise young people especially feel that they have no control over what is happening around them and to them. We understand needs across a spectrum of needs, which will include health and well-being. This would be both physical and mental health, but also, I'm talking about a multidimensional lens on vulnerability and need, which is essential to look at everything in a holistic, integrated manner. So you're talking of health and well-being, you're looking at education and life skills, where you're looking at something like comprehensive school safety, where you're working on disaster risk reduction and so on, building disaster preparedness at the school level. You're looking at sustainable livelihoods, where for the communities where these children and young people live, obviously. You're looking at child protection, which then works to build resilience. And you're looking at giving voice and agency, that this is also a need which needs to be addressed. So when you have this multidimensional lens on tackling the needs and vulnerabilities arising out of climate, the risks imposed by the climate crisis, that is when you can be sure that you are helping to make young people resilient, you're helping them to tackle the effects of climate change on physical and mental health, and you're giving them the necessary skills, knowledge and tools to be able to go out there and to be able to have a roof over their heads, to have a livelihood, and to also have a voice in the key decision-making processes affecting their lives.
Thank you.
Thank you.
Okay, yeah, let's finish. Julie, I want to hear from you on what the innovation or innovative ideas or policies that can be implemented or can be discussed or can be developed in order to ensure climate resilience.
Great. So I think this has come up a few times, but I mean, there are a lot of overlaps in terms of solutions that will build the climate resilience of cities, as well as like help people with their mental and physical health and well-being, right? I mean, there's a lot of overlaps between air pollution, between, also the unequitable allocation of space, especially when we're talking about green space in cities. We see this around the world, that wealthier neighborhoods have more green space, and that tends to not be accessible by people who live in poorer neighborhoods. I would say there's every city and community is different, but I would say in general there's kind of three kind of concrete areas that will tend to help with both climate resilience and physical well-being. So one is green space and trees. Shade is always great, pretty much. It can take different forms, but shade is always important. Drainage is huge in terms of making sure places are still accessible and making sure that children can still get to school, making sure that they still have places to play. Drainage is, if every city, I think, added more shade and green space, improve their drainage, and the last one is improve their waste management, it would make a huge difference in terms of climate resilience and health. But really every community is different, so actually, I know we don't have much time, but if you just close your eyes for a second and think about where is your favorite place in your city or a city that you've lived, and what does it look like, and why is that your favorite place, right? What makes that place special to you? But then also think about is that a place that, can you use that place when it's really hot? Can you use that place when there's heavy rain? can everyone use that place, right? Is that place a place that's accessible for the elderly? Is it a place that works for people who work outdoors? I mean, for example, I would say my favorite place in my city in Brussels is my neighborhood because it has beautiful historical buildings, but also my friends all live right around there. I can walk to their houses, I can meet them at restaurants. But it's a terrible place when it's really hot, which doesn't happen a lot in Brussels. We don't have a lot of super hot days. But when it does happen, I can't walk the 20 minutes to my best friend's house because it's too hot and there's no places in between for shade. It also doesn't work to ride my bike when it rains heavy because there's cobblestones and there's tram tracks, and so it's really slippery, and all of a sudden my preferred mode of transport doesn't work for me anymore because as soon as the road starts to flood a little bit, it becomes too hazardous, right? But so the point here is, there's places that are all our favorite places, right? And they're being changed by climate change, by deforestation. And they all need different solutions. And, I think we all have to take that moment to think, okay, what is the solutions that I think work here? And really work together with experts, with people at the city government level, with other people in a community to identify what those changes are. And again, I think there are broad brushstrokes like shade that work everywhere, but even within that, there's a lot of different nuance, right, in terms of the types of trees, in terms of what that green space looks like, and how is it culturally appropriate. And I think it's on one hand really easy to identify these things, and on the other hand to get them right so that they actually work and function for generations to come is extremely difficult. I'll just say two last things. One is I will also do my little plug for talk about climate finance. We are releasing a report tomorrow because we did an analysis of the extent to which climate finance is targeting the urban poor. So a really critical community that's affected by climate change, and no surprise, I think, to many people here, they are not one of the major recipients of funding. And so we have a publication we're launching tomorrow that looks at this. And the last is we in the morning will do a session about a toolkit for women-led climate action and some indicators that you can look at in terms of gender and climate and energy and water for more integrated approaches. So if you're interested in either of those things, we could talk afterwards. But sorry, that's my little plug for my items, if you don't mind.
Thank you, Julie. You don't mind. Yeah, thank you so much for our panelists. A hand of applause for them. Yeah, we are running out of time, and we should have a question and answer session, but we'll discuss after the next session. So you can go. Thanks so much.
Thank you.